Women's Health Month, and millions of women suffer from atrial fibrillation, or AFib.
Yeah, it's the most common heart rhythm disorder, and Action News Jack's Phil Amato talked with a local woman who has it about the warning signs and the doctor who helped her.
At 52 years old, back in 2019, Kathy Foster started experiencing an irregular heartbeat. She visited her cardiologist, who diagnosed her with AFib. Kathy tried multiple medications, but nothing was effective at managing her symptoms. She then went to Dr. Samil Oza, an electrophysiologist at Ascension St. Vincent's, for treatment. She opted for a catheter ablation. That's a procedure that interrupts irregular electrical pathways.
For me, the procedure was the last option. I had been through trying different medications at first and got referred to Dr. Oza.
We're able to take a tiny, basically a tiny catheter that we thread through a vein in the leg up to the heart and cauterize tissue in the heart that's responsible for the atrial fibrillation, thereby restoring their normal rhythm and relieving their symptoms.
Kathy and Dr. Oza are raising awareness about the dangers of AFib and want to remind women to pay attention to symptoms.
I went to lunch one day, and upon leaving, my heart started racing, and I thought, well, I may have just had too much tea to drink for lunch, and my heart was just pounding, and my Apple Watch actually gave me a high heart notification.
It can be as obvious as a fish flopping around in your chest or palpitations like Kathy described. However, it can also be something a little less precise, such as shortness of breath.
Kathy says she's feeling much better and has a renewed focus on her health. She's lost 40 pounds since the procedure and intends on losing more. For local coverage you can count on, Phil Amato, Action News Jax.
There's a lot of information about AFib, including the symptoms and treatment options, on the Get Smart About AFib website. We have a link to all of that information on actionnewsjax.com.
Today, Florida lawmakers passed a plan that will prevent